Our next panelist is a young microbiologist, Dr. Ardra Menon, who works as an assistant professor of microbiology department of GMC Thrissur. She completed her education from different government medical colleges of Kerala. She is an extremely enthusiastic microbiologist and has years of experience in the field. As a microbiologist, she has always been fascinated about bacteriology and hospital infection control. She has worked alongside the ICTC, Institutional Research Committee, and is currently undertaking COVID-19 investigation duties. Dr. Ardra was also a part of various researches on microbiology, including antimicrobial resistance. We give her a wholehearted warm welcome to this panel. Ardra ma'am, here is your first question. What are the common organisms or diseases exhibiting antimicrobial resistance in our healthcare? Do we have many reports?
So, like in the world or India surveillance, Kerala also, the 6 pathogens of public health importance we are mostly dealing with, and we are encountering that also. There is the escape pathogens. So that includes the 2 gram-positive organisms, Enterococcus faecium, Staphylococcus aureus, Klebsiella pneumonia, Acinetobacter baumannii, Pseudomonas aeruginosa, and we have got Escherichia coli, not Enterobacter, Escherichia coli. So these are the 6 common pathogens that we always encounter, showing the multi-drug resistance, even in our setup, in our local setup also. Then we rarely encounter resistance in diarrhea like Salmonella, Shigella, and gonorrhea. It is sexually transmitted. It is only underreported in Kerala as such. Okay, the resistance to gonorrhea. Now, the sites from which we get, it is mainly, as you know, the bloodstream infections, skin and soft tissue infections, respiratory tract infections, UTI. If you are taking the healthcare associated infection type, it is usually from the catheter associated urinary tract infections, central line associated CLABSI, central line associated bloodstream infections, ventilator associated pneumonia, and surgical site infections. So these are the sites from which we usually get the infections. And as Sir was telling, mostly we are worried about bacteria and we are forgetting about the other things. So candida, antifungal candida resistance is also very common. And in our the studies in our institute have also shown that we have a lot of candida isolates which are becoming resistant. It's again tuberculosis, drug-resistant tuberculosis. As all of you know, it is very rampant now. It is common in India. Tuberculosis is endemic in India, and so we have got a lot of cases of MDR resistant and XDR TB also. So these are the common organisms or diseases. And reporting in Kerala is always it's only tip of the iceberg that we are seeing. So in 2019, there was a multicentric study which was conducted all over India, and all the 6 medical colleges in Kerala also took part in that. And again in 2019, again from the government medical colleges in Kerala took part in a study on the antibiotic stewardship and antibiotic. And with that thing also, we saw that a lot of organisms, so vancomycin resistance enterococci, it was almost 4% in our studies. Again, methicillin resistant Staphylococcus aureus, 39%. ESBLs, extended spectrum beta lactamase, that we are seeing. That is high in all the gram-negative organisms that I mentioned, especially high in Escherichia coli and carbapenemase-producing bacteria. Carbapenem is considered the treatment of choice in ESBLs. The carbapenemase-producing bacteria is also in Acinetobacter, we got it as high as 36%. So this is very, we are seeing, and even colistin, which is the last resort drug in treating the multi-drug resistance in healthcare, even that we are getting, it is less than 1% in these studies, but the problem is that it is underreported. Colistin is being used rampantly nowadays. We are using it. A lot of the clinicians are using it. So it is also underreported. So we have got antimicrobial resistance in our setup also.
Ma'am, the next question is, what are the common mechanisms of antimicrobial resistance?
I think, as you know, there are 2 types of drug resistance mainly, intrinsic and acquired resistance. Intrinsic resistance is exhibited by all the strains, and it is the inherent nature of the organism. So, for example, the vancomycin resistance in gram-negative bacteria, the ampicillin resistant in Klebsiella, etc. Whereas acquired resistance is acquired, it's only by only some strains, and it is not inherited. So it is usually by gene transfer methods or by mutations, as in the case of Mycobacterium tuberculosis. So the main four mechanisms by which the microorganism exhibits the resistance is main one is the limiting the uptake of the drug. The drug is not entering into the cell. That is mainly seen in gram-negative organism because of the change in the structure of the porin channels. So again, porin changes, and sometimes in gram-positive bacteria, for example, vancomycin intermediate Staphylococcus aureus by the thickening of the Staph aureus cell wall. The second mechanism is modification or alteration of drug target. The drug changes. The bacteria, drug after entering into the bacterial cell has to attack a target. So it has to go and attack. There will be modification. The classical example is the alteration in the penicillin binding protein, PB2A in MRSA, methicillin resistant Staphylococcus aureus by MEK gene, and also the vancomycin resistance in VAN genes, in Enterococcus species. Okay. Then the third mechanism, inactivation of drug by enzymes. Here also the enzyme can completely hydrolyze the drug. For example, beta-lactamase, very important. Also the ESBLs, the AMCs, etc. And then the aminoglycoside modification. The fourth mechanism is, these are the four more common mechanisms. There are other mechanisms. I'm just mentioning the four common mechanisms. Fourth mechanism is the pumping out of the drug. Drug reflex, that is mainly by gram-negative organisms. So the first and last one, uptake, inhibiting the uptake, and also the pumping mechanism is mainly seen in gram-negative organisms. Gram-positive bacteria, usually most of them do not show these two mechanisms, only the other two mechanisms. So these are the mechanism of antimicrobial resistance, but there are other important factors contributing to antimicrobial resistance. One is the environmental factors like the huge population, overcrowding, increased traveling, very important, poor sanitation, widespread use of antibiotics in animal husbandry and agriculture, and medicated cleansing products. That is important. Drug-related factors like the quality of the drug, overuse, over-the-counter availability, irrational fixed drug combinations, patient-related factors like poor adherence to the treatment, lack of education, self-medication, very important, physician-related, lack of current knowledge, inappropriate use, prescribing a lot of empirical antibiotics, overuse. I feel that misuse and overuse of antimicrobials are the main drivers in the development of drug-resistant pathogens. That is the most important thing. And in India, especially, I feel that the lack of enforcement of legislation. You don't have rules, you don't make it strict, nobody follows it here. So that is one thing. Thank you.
Thank you, ma'am.